Imagine discovering that the secret to longevity might be hidden in your kitchen, but at the same time, it could bring risks you never considered. Curious to learn more? Let's dive into this journey together. Like and subscribe to our channel. Each like and subscription helps us bring you more quality health content. Your participation makes the difference. Turmeric, known for its anti-inflammatory and antioxidant properties, is often praised as a superfood. However, despite its many benefits, turmeric can have adverse effects on digestion that are often underestimated. In some individuals, especially those sensitive to spices or with pre-existing digestive conditions, turmeric can cause gastric irritation. This occurs due to curcumin, the main active component, which, although beneficial, can stimulate the production of gastric acid if consumed in large quantities. For people prone to conditions such as gastritis or ulcers, this can result in discomfort, pain, and other digestive symptoms. Moreover, excessive consumption of turmeric can lead to dyspepsia or indigestion, manifesting as heartburn, bloating, and abdominal pain. These symptoms can be exacerbated in people who already have digestive sensitivities or who consume turmeric in combination with other spicy or irritating foods. While turmeric is generally considered safe when used in culinary amounts, self-medicating with curcumin supplements without medical supervision can lead to excessive doses, increasing the risk of adverse side effects. Therefore, it is important to monitor the amount and frequency of its consumption, especially in supplement form. Finally, it is essential for consumers to be aware that while turmeric can offer numerous health benefits, it is not without risks, particularly for digestive health. Individuals with a history of gastrointestinal issues should consult a healthcare professional before starting regular use of turmeric or curcumin. This way, they can maximize the benefits of this powerful antioxidant while minimizing potential discomfort and adverse reactions, ensuring a balanced and safe approach. Although turmeric is widely acclaimed for its anti-inflammatory and antioxidant benefits, its impact on the liver is an aspect that deserves greater attention. Moderate consumption of turmeric is generally safe for most people, but excessive use, especially in the form of concentrated supplements, can impose significant stress on the liver. Curcumin, the active ingredient in turmeric, can be metabolized by the liver, and high doses can overload this vital organ, leading to conditions such as hepatotoxicity. This is particularly relevant for people who already have liver conditions or who use other medications that affect the liver, as curcumin can interact with these medications and intensify their effects. The risk of liver damage associated with the use of turmeric supplements arises mainly due to their high concentration of curcumin. While turmeric used as a culinary spice contains curcumin in levels that are generally considered safe, supplements can offer much higher doses. These doses can not only overwhelm the liver, but also alter hepatic enzyme function, potentially leading to an imbalance in the metabolism of other substances. Additionally, the lack of regulation and quality control in supplement manufacturing can result in products containing impurities or inconsistencies in dosage, further increasing the risk of adverse effects. Therefore, it is crucial for individuals to consider the potential implications of excessive turmeric use for liver health, especially in supplement form. Consultation with a physician or hepatologist is advised before starting the use of turmeric supplements, particularly for those with a history of liver disease or those on complex medication regimens. Regular monitoring of liver function during the use of these supplements can help prevent potential damage and ensure that turmeric is used in a way that supports overall health without compromising liver function. Turmeric is a spice valued both in cooking and natural medicine for its anti-inflammatory and antioxidant properties. However, its consumption during pregnancy requires caution due to potential risks associated with fetal development. Curcumin, the active component of turmeric, can influence hormone levels and blood circulation, which are critical during pregnancy. Studies have suggested that high doses of curcumin may stimulate uterine contraction or alter hormone levels, potentially leading to complications such as preterm labor or even miscarriage. In addition to the possible effects on labor, the safety of turmeric in high doses has not been clearly established for pregnant women. While the consumption of turmeric in culinary amounts is generally considered safe, the use of turmeric supplements is a matter of concern due to their high concentration of curcumin. Supplements can exceed recommended intake limits, exposing both the mother and the fetus to potentially harmful levels. Therefore, it is essential for pregnant women to consult a healthcare professional before starting any turmeric supplementation to ensure they do not exceed safe doses and do not risk the health of the baby. Finally, the lack of robust studies on the effects of turmeric consumption during pregnancy means that the precautionary principle should prevail. Pregnant women are advised to use turmeric strictly as a culinary spice and avoid supplements unless prescribed by a doctor. Maintaining open communication with healthcare professionals about all supplements and herbs consumed is crucial to ensure a healthy and safe pregnancy for both the mother and the baby. When considering the use of turmeric, the safest approach is to opt for moderation and well-informed decisions. Turmeric, frequently praised for its healing and anti-inflammatory properties, contains curcumin, which can have significant anticoagulant effects. This aspect of turmeric is beneficial for many, but can pose a risk for individuals with bleeding disorders or those undergoing treatment with anticoagulant medications, such as warfarin. Curcumin can enhance the effect of anticoagulant medications, increasing the risk of bleeding. This is especially critical during surgical procedures or in cases of injury, where proper blood coagulation control is essential to prevent excessive bleeding. Moreover, the anticoagulant effect of turmeric may not be widely recognized by consumers, leading to an inadvertent risk of dangerous interactions. People who regularly use large amounts of turmeric, whether as a spice or in supplement form, may not be aware that they are potentially increasing their chances of complications related to bleeding. It is vital for both doctors and patients to discuss the use of any natural supplements, including turmeric, to avoid negative interactions with prescribed medications, particularly those related to blood coagulation. Therefore, it is essential that there be greater awareness of the risks associated with turmeric consumption for people at risk of bleeding. Healthcare professionals should inquire about their patients' use of supplements and herbs, and individuals should be educated about the potential side effects of natural products like turmeric. Patient safety can be significantly improved with awareness and careful management of interactions between medications and natural supplements, ensuring that the use of turmeric is both effective and safe. Turmeric, despite being a spice valued for its medicinal and culinary properties, can also be a source of allergies for some people. Allergic reactions to turmeric can range from mild to severe and are important to recognize to avoid serious complications. Common symptoms include skin rashes, hives, itching, sneezing, nasal congestion, or difficulty breathing. In rarer cases, turmeric can cause a severe allergic reaction known as anaphylaxis, which is a medical emergency requiring immediate attention. For those who suspect an allergy to turmeric, it is crucial to monitor the body's response after consuming this spice. If symptoms such as swelling of the lips, tongue, or throat, or a feeling of tightness in the chest occur, seeking medical help immediately is essential. Identifying adverse reactions can be complicated by the fact that turmeric is often used in spice blends and complex dishes, making it difficult to determine the exact cause of the allergic reaction. To manage and prevent future allergic reactions, individuals with a known allergy to turmeric should avoid its consumption and be aware of products that may contain it. Reading food labels and inquiring about ingredients in restaurants can help prevent inadvertent exposure. Additionally, consulting with an allergist can provide further management strategies, including the possible use of medications to relieve symptoms in case of accidental exposure. Awareness and prevention are key to dealing with turmeric allergies, ensuring that individuals can avoid adverse reactions and maintain a good quality of life. Turmeric, despite its numerous health benefits, can have some side effects concerning oral health. One of the most immediate aspects is its ability to stain teeth. Due to its strong pigmentation, turmeric can leave a yellowish tint on teeth after regular consumption. This effect can be particularly concerning for people who value the aesthetics of their smile, as removing these stains often requires specialized dental treatments, such as professional cleanings or even teeth whitening. Beyond aesthetic issues, there is a potential concern about the impact of turmeric on gum health. In some cases, excessive consumption of turmeric can lead to gum irritation, manifesting as sensitivity or inflammation. This condition can be uncomfortable and, if left untreated, may contribute to more serious gum problems. Individuals with pre-existing oral health conditions should be particularly cautious, as curcumin, the active compound in turmeric, although possessing anti-inflammatory properties, can exacerbate sensitivity in already compromised tissues. Another aspect to consider is the effect of turmeric on oral flora. While some research suggests that curcumin has antimicrobial properties that can benefit oral health by combating pathogenic bacteria, excessive use can disrupt the balance of the oral microbiota. This imbalance can lead to changes in the composition of bacteria in the mouth, potentially favoring the development of cavities or periodontal diseases. Therefore, it is crucial to moderate turmeric consumption and maintain strict oral hygiene to minimize these risks. Finally, when considering the use of turmeric, especially in supplement form, it is important to discuss with a healthcare professional or dentist how it may affect individual oral health. People who already have dental or gum problems may need additional guidance to ensure that turmeric consumption does not exacerbate their conditions. Thus, a balanced and informed approach is essential to enjoy the benefits of turmeric without compromising oral health. Turmeric, often cited for its antioxidant and anti-inflammatory properties, is also explored for its potential benefits on mental health. However, despite the frequently publicized positive effects, it is crucial to consider how turmeric can adversely influence mental health in certain individuals. In some cases, curcumin, the primary active component of turmeric, may exacerbate symptoms of anxiety and depression. This can occur due to curcumin's interaction with neurotransmitters involved in mood regulation, such as serotonin and dopamine. Alterations in the levels of these neurotransmitters can lead to emotional imbalance, especially in sensitive individuals or those with pre-existing conditions. Beyond the direct impact on neurotransmitters, the use of turmeric supplements in high doses can cause side effects that indirectly affect mental health. For example, excessive consumption of turmeric has been associated with sleep disturbances and irritability, factors that can worsen mental health conditions such as anxiety and depression. Individuals already undergoing treatment for these conditions should be particularly cautious, as the interaction between curcumin and psychotropic medications can be unpredictable, exacerbating side effects or reducing the efficacy of prescribed treatments. It is also important to consider the expectations and psychological impact of using natural remedies like turmeric. Some people may experience a phenomenon known as the nocebo effect, where the expectation of negative effects contributes to the manifestation of adverse symptoms. Therefore, even the beneficial properties of turmeric can be overshadowed by concerns and anxieties about possible side effects, particularly in individuals inclined to health worries. Given these considerations, it is essential to consult healthcare professionals before starting the use of turmeric supplements, especially for individuals with existing mental health conditions. A personalized and monitored approach is crucial to ensure that the use of turmeric is beneficial and not harmful to mental health. Keeping an open dialogue with mental health professionals and doctors can help navigate the use of complementary treatments like turmeric, ensuring its therapeutic potential is maximized without compromising emotional and psychological well-being. Turmeric is widely used both in cooking and in alternative medicine due to its anti-inflammatory and antioxidant properties. However, despite its benefits, some people may experience negative skin effects due to turmeric consumption. One of the most common dermatological problems associated with turmeric is contact dermatitis, a form of allergic reaction that can occur with direct skin contact with the spice. This condition manifests as rashes, redness, and itching, which can be particularly uncomfortable and persistent. Besides contact allergic reactions, excessive consumption of turmeric, especially in supplement form, can lead to other inflammatory skin reactions. Curcumin, the active compound in turmeric, while benefiting internal health with its anti-inflammatory properties, can paradoxically exacerbate or trigger skin inflammations in people with sensitive skin or pre-existing conditions like eczema or psoriasis. In such cases, curcumin can disrupt the skin's immune balance and worsen the symptoms of these conditions. Additionally, turmeric can interact with medications, increasing skin sensitivity to the sun, known as photosensitivity. This reaction heightens the risk of sunburn and sun damage, even with short exposures. Individuals who regularly consume turmeric should be cautious about sun exposure and consider using adequate sun protection to mitigate this risk. Therefore, while turmeric has many beneficial properties, it is crucial for those with sensitive skin or existing dermatological conditions to consult a dermatologist before starting regular turmeric use, whether in the diet or as a supplement. This will help ensure that turmeric use is safe and beneficial without compromising skin health. Awareness of turmeric's potential dermatological side effects is essential to avoid and manage possible adverse reactions. Turmeric, celebrated for its antioxidant and anti-inflammatory properties, is commonly used both in cooking and in supplementation regimes to promote overall health. However, prolonged and continuous consumption of turmeric, especially in high doses, can lead to cumulative effects that are not always beneficial. In the long term, curcumin, the main active ingredient in turmeric, can interact in complex ways with various body systems. In some people, excessive use can lead to gastrointestinal irritations, such as gastritis or abdominal discomfort, especially if consumed in significantly higher quantities than typical in a regular diet. Besides potential adverse effects on the digestive tract, there are concerns about turmeric's impact on liver function. The liver, responsible for metabolizing curcumin, can be overburdened by high and frequent doses, increasing the risk of conditions like hepatotoxicity. These risks are amplified in individuals with pre-existing liver conditions or those on regular medication that also requires extensive liver metabolism. Thus, while turmeric is generally safe when used in culinary amounts, vigilance is crucial when it comes to prolonged supplementation. Another important consideration is turmeric's potential to affect iron levels in the body. Curcumin can bind to iron and impede its absorption, which can result in decreased levels of this essential mineral over time, especially in people with diets already limited in iron or conditions like anemia. Therefore, although turmeric can offer several health benefits, it is essential to monitor and adjust consumption as necessary, particularly in individuals vulnerable to these adverse effects. Consultation with a healthcare professional can help guide appropriate turmeric use, ensuring its benefits are maximized without causing long-term health harm. Have you ever thought about the long-term impact something as common as turmeric can have on your health? But don't leave yet! In our next video, we'll dive even deeper. Did you know that certain everyday foods can be true heroes or villains for your well-being? Stay tuned, subscribe to the channel, and hit the bell icon so you don't miss out. And tell me in the comments, have you ever had a negative experience with natural supplements? Let's chat!